One of the hardest sort of class of patients that we see is the patient who perhaps has undergone not just rhinoplasty, but also at least 1 or 2 or 3 previous revisions, and they're now presenting at a state where they're wondering, hey, is it safe for me to undergo this procedure? You know, there's that constant fear of this Michael Jackson effect, where they're afraid they're going to lose their nose, and they want to know, is it even safe to pursue the procedure?
Yeah, these are patients very often who kind of at the end of the road. They feel like they've lost hope, they've lost trust, they don't know who to listen to anymore in terms of what's possible. And we feel an even greater responsibility that we shoulder for many patients like that to really be very honest with them from the get-go in terms of exactly what they can accomplish. We never overpromise, but for many of those patients, if they're now in the hands of revision rhinoplasty experts who have a lot of experience dealing with these kinds of things, there can very often still be significant benefits to be had.
Absolutely. You know, what we'll tell most of those patients is, you know, one, probably the most important factor to look at is the skin quality itself. It has the skin sort of shrunk back to the place where there just isn't any laxity there. Or if you don't have any give to the skin, then oftentimes there's only so much you can do. 2, if there's a lot of scar tissue, then you have to be willing to understand that sometimes you're going to go in, take out all that scar, and it's going to look great. It's going to, even a year later, 2 years later, look far better than it does, but you might have to build into the idea that, hey, in 10–15% of those people, you're going to have to go back and remove that rind again. But most important, I think, and this is where you're going to talk a little bit, is it's important that the surgeon is not just whittling away. They're not just constantly going back and removing more structure. That if you're going to go back and do something, it's really first and foremost to stabilize, make sure the nose is able to hold up, has some real support and strength.
Yeah, and that's where really building back structure makes all the difference. For a lot of patients, they've had reductive rhinoplasties where they had too much cartilage removed, and maybe another surgeon wanted to try to take even more cartilage away. And that's where problems happen with collapse, with breathing issues, with twisting, with loss of support, and that those sorts of things tend to get worse over time. We're very big fundamentalists in terms of building back structure and support to the nose, so that this is the last rhinoplasty you have to have, and that sets you up for the rest of your life to really be able to breathe comfortably, to be able to have a shape that stays that way as you age, and actually ages far better than if you never had anything done.
Yeah, it's really important when you're hearing Dr. Litner, you know, increased support, increased strength does not equate to bigger nose. There's a big difference between those two things. You can actually remove scar, you can do things to make the nose smaller as long as you're leaving support or building support so that the skin has somewhere to contract. That's what's really important.
And sometimes it does equate to bigger nose when needed.
Sure.
So a lot of patients have been over-shortened, have been scooped out, and they look really unnatural. One of the hardest things to do in revision rhinoplasty is to be able to restore length, to take a tip that's been over-shortened and bring it back to a normal, natural length. We found that using rib grafting over many hundreds of patients over many years, we've been able to get to a place where we can comfortably tell patients we can get a really nice change and be very honest about what that change is. The one caveat to have a discussion with the surgeon about always is the skin quality, like you said. Structural problems can often be dealt with. If the skin has been previously injured, those are patients where we sometimes might have to have a little bit more of a discussion about the limitations of surgery, but even then, in many cases, you can do very, very well.
So what you're really hearing from us is just, if you're in the position where you're wondering, hey, have I done too much? Really, if you're going to go further, make sure you're seeing somebody who has a lot of experience with revision. You know, this is not the sort of thing where you're seeing a surgeon who does a handful a year. You know, these have to be people who are doing 50, 100, 150 revision cases a year.